The Nazi Mysteries. The immediate post-war years were all too heavily burdened with the tragic consequences of the Third Reich for its image to be anything but negative among the Western Allied nations. The wholesale destruction of Europe through German militarism and the gruesome extermination of the Jews combined to make Hitler and National Socialism the objects of universal condemnation and horror. That's from Aryan Cults, Esoteric Nazism and the Politics of Identity, Black Sun by Nicholas Goodrick Clark. Very good book. Hello and welcome to another edition of the Stench of Truth. I want to give you an update on my Freedom of Information Act request that was originally placed with the Department of Homeland Security and the Federal Emergency Management Agency for information regarding FEMA camps, trains, what to do in the event of pandemics, etc., etc., etc. Now, I've received a couple responses from a couple of different agencies. I know I got one from the Transportation Safety Agency, I believe, TSA, which said that they didn't have anything in their records for me. Well, lie, truth, I don't know. But I got one today from the Department of Health and Human Services and the Public Health Service Centers for Disease Control. Now, this is pretty much what I expected, okay, this in relation to my Freedom of Information Act request. This letter is in response to your Freedom of Information Act request of April 23rd, 2009 pertaining to documents related to contingency for outbreak of major illness, quarantine facilities, laws, and regulations. In order to process your request as written, program staff estimate the fees to be $3,681. See enclosed invoice. It will be necessary to pay the charges before release. This fee is assessed in accordance with the department's implementing regulations. 45 CFR Part 5 mailing instructions are on the invoice. And on the invoice it says that the search costs would be 80 hours of searching under rate 2, which is GS 9 to 14, which is $45 an hour, which comes to $3,600. And 3 hours for rate 3, which is GS 15 and above. And that's $81 an hour, coming out to $243. The first 100 pages of any documents reproduced would be free. Everything beyond that would be 10 cents a page. So that comes out to $3,681 just for them to search. This is the kind of thing the bureaucracy does. They tell us, oh, you have a Freedom of Information Act, but if you want us to find the fucking information for you, you gotta pay us a fucking fortune. And you know what? If I had the fucking money to pay this, I would. But you know what? Even if I did that, chances are good they would tell me, it would give me a bunch of fucking useless nonsense that wouldn't even answer my fucking request. And this is not the way I worded my Freedom of Information Act request anyway. But there you have it. $3,681 just to fucking look for the shit I want. Okay? Now that brings me into the point of this video. And that is in regards to the swine flu. Okay? Now, I've been reading a lot in the news over the last couple of days about how the vaccine makers are really pushing for to get a swine flu vaccine on the market so that they can protect all of us from the deadly, nasty H1N1 swine flu virus that's going to rip through the entire population and kill everybody. Well, you know what? I thought we recognized the hype a long time ago, and I think we did. And I think that a lot of us knew that this was just going to be overblown. You know what? They didn't catch on yet, so they're still riding the coattails of this thing. So I imagine that whatever is going to come, it is going to be in conjunction with this whole swine flu mess. They're still going to use it. They're still going to use it for whatever they want to do, whether that's to test some kind of fucking ridiculous fucking drugs on the American people, or whether they want to kill people off, or whether they just want to sit back and laugh while people fall for it or are forced to get vaccinations or whatever. You know, I thought we had picked up on this right away. I thought everybody picked up on this being a big, hyped up, go nowhere story. And yet, here we are, with people still, the government still pouring on the propaganda and the information to us that this is going to get worse. It's going to mutate into some really deadly form, and it's going to kill so many people. We have to have a vaccine. Well, who's going to benefit the vaccine? Giant fucking pharmaceutical companies? You bet, buddy. You fucking bet. And I guarantee you, if they continue with the way they're going right now, vaccines are going to be mandatory. You know what? You know what the testing consists of? They test the fucking thing on adults for 2 weeks, and then they give it to children. 2 fucking weeks. We don't even know what the fuck is in any of these motherfucking vaccines. Don't know if they have viruses in them. Don't know what kind of adjuvants they have in them. And they want to jab everybody with this fucking shit? Well, needless to say, I say to tell those fuckers to go fuck themselves collectively if they try to come and tell you, you got to take a fucking flu shot. As of right now, according to the CDC, there are 40,617 cases, either confirmed or probable. What is the percentage of one or the other? Confirmed or probable? Are there 10 confirmed cases and 39,000 probables? I don't know. They don't say. Confirmed and probable, all put into the one category of 40,617. And as of right now, deaths attributed to H1N1 in the United States, 263, 0.5%, roughly. Now, not everybody is going to contract the swine flu. There are 40,000 cases right now. It's already been through the country. It's everywhere now. Why we should expect it to get worse, although they keep harping about mutations and becoming more deadly and everything else. Why should we expect it to get worse? We shouldn't. Why should we think this is something that's going to turn into a major disaster? We shouldn't. But they're focusing on it, so we need to be focused on it too, because they're going to usher in something with this, whether it's to put something in the vaccine and expose you to it, or whether it's to enact some new health laws or whatever. This is something we need to stay focused on. I thought we could move on from this, but no, the government still is pouring forth the shit about this, and because they're doing that, we need to stay focused on what's going on with this and what's going on with the vaccines. I want to point out one other thing very quickly, and that is in 1976, when the swine flu outbreak happened back then, 500 people who received the vaccine developed Guillane Barre syndrome. Okay, 25 of those people died. Okay, at that time, there were only 200 confirmed cases of swine flu. Okay, and of all of the cases of swine flu in 1976, there was only 1 death from swine flu. Okay, and it was much, much more localized. So you see, there's a great disparity between the deaths then and the deaths now, but there's also a great disparity between what you would expect when you're getting a vaccine. You expect getting a vaccine that you're going to get something that's going to give you another fucking disease, and they're going to test these vaccines. They're testing them right now. They're calling for volunteers. They're only going to test them for 2 weeks before they give them to fucking children. Children. If you're against fucking vaccines at all, you should be absolutely mortified that they would consider giving your son or daughter a fucking flu vaccine after having tested it for 2 fucking weeks. I know I am. And I don't even have any fucking kids. Thank you. Good night.